Hey there, I'm 𝗢𝗡𝗟𝗜𝗡𝗘. I'm one of the OET faculties at Leedz Academy, Thrissur. In this video, we basically focus on the common mistakes which the students make during their speaking module of OET. Okay, so let me discuss more about the role play card. Here the patient has undergone a mastectomy surgery about 5 days back, and further she is also a patient of diabetes with elevated sugar levels and she is on insulin administration. So the scenario is that she is really finding it hard to cope up with her current body image, and the nurse here over here is required to give her some mental support and some practical advice which can help her to cope up with her current situation. So let's have a look.
Hello, good morning.
Good morning, nurse.
I am 𝗢𝗡𝗟𝗜𝗡𝗘, one of the registered nurses working in this hospital ward. Today I will be taking care of you.
Oh, yes, nurse. Okay.
Okay, so for more confirmation, may I know your name, please?
Yeah, my name is Angelina John.
Okay, Miss John. I have gone through your case notes and I got an idea that you recently underwent a mastectomy surgery. Is that right, Mr. John?
Yes, nurse.
Okay.
Students, as you can understand that many of the disease conditions are common for both the genders, male and female, but some are not. So while you are reading your role play card, it is very important to understand that whether the disease condition provided to you is a gender specific or not. For example, in this role play card, the patient has undergone a mastectomy surgery, so she is a female patient for you. So in this case, the nurse has addressed the patient as Mr. John, and this amounts to gender error, which should not be done during your role play card, and the patient should be addressed as Miss John, not Mr. John. So you should be very conscious about the gender while addressing the patient.
So, how do you feel now?
Well, I'm feeling very sad, very depressed about my own body image. Now, it's really very hard for me to cope up with my current body image. As you are a woman, you can really understand that how it feels to be that one of your breast, if it is not there. And
Yes.
I feel so incomplete about my body image because I feel that it can really affect my life very badly. Let it be personal or let it be professional, and I feel so incomplete as a woman nurse.
Yes, from your face, I can really sense that you are so sad and depressed about your condition. But try not to worry. We are here to help you, and we will take your health and means health and safety are our utmost priority. Okay.
Yes,
there are
nurse.
some options. Okay. I will discuss in detail about it, which will really help to overcome your current situation.
Oh, is it? Yes.
Okay. So may I discuss that options?
Yes, please. Yeah.
Okay, so first I would like to explain regarding the prosthetic bra. Have you heard about it?
No, nurse, no.
Okay, so in this prosthetic bra, you can purchase this from the medical stores, okay, and it will provide you a real breast image actually. Okay, so are you able to follow me?
Yes, nurse. Yes.
Okay, so do you have any questions in this?
No, I don't have. But nurse, tell me if it can really, because it is just a temporary solution to my problem, isn't it?
Yes.
But is there anything else, which can really advise me on?
Yes, of course. The other option is breast reconstruction surgery.
Okay.
You can go for this surgery after 6 months only, actually. Okay. In this situation, means your wound needs to be completely healed prior to this reconstruction surgery. Okay. And in this surgery, what we will do means we will take some tissues from other parts of your body,
Okay.
and we will construct to that area. Okay. So is it clear to you?
Okay, nurse, yes. But I have a few queries. Nurse, actually I am planning to have a baby in about next 3 years.
Okay.
So do you think that I'll be able to breastfeed my baby?
Yes, I can understand your concerns about your new baby.
Students, it's important to put emphasis on appropriateness of language. For example, here the nurse has told to the patient that I can understand your concerns about your new baby, though the baby is yet to be born. So what I recommend is that the nurse can address the patient's concern by saying that I can understand your concerns about breastfeeding.
Actually, in this situation, you can breastfeed your child as normal after the reconstruction surgery. Okay.
Okay, nurse, yeah.
Okay.
But nurse, tell me how long it will take for me to recover completely, nurse?
Actually, it will take around 1 week for a complete recovery.
I see. Okay, is it like that? Because I have read somewhere that diabetes patients take much longer time to recover, and I am presently on insulin administration. So, do you think that my recovery would be so fast?
Yes, I apologize for my overriding. Actually, it will take some time. It will take more than 1 month for a complete recovery because you are on insulin. I have seen in your case note actually, but I forgot. Sorry to say that. It will take. Okay.
Students, it is very important to consider the primary concern of the patient, that is the primary medical condition of the patient. But apart from that, it is always important to have a general idea about the previous medical history of the patient. For example, here the patient is having elevated level of blood sugar, that is she is diabetic and she is under the treatment with insulin administration. So when the nurse is conveying to the patient that your wounds will get healed within 7 days, so that is really not possible, because diabetes patients, they take much longer time for wound healing. So keeping that in mind, you have to convey to the patient that we expect a good recovery for you, but I suspect that it will take a much longer time than 7 days. But of course we will monitor your prognosis during the treatment, and we expect a good recovery. Nurse, I am also afraid that I am experiencing an abnormal mood swings. This has really affected my relationship with my husband. So, is it normal for a woman who undergo this surgery to have such mood swings?
Yes, actually, I can understand that it.
OET speaking is all about an interaction between a healthcare professional and a patient. So it is quite natural that in a communication a pauses can happen at appropriate instances. But when a person have frequent pauses due to lack of language or due to the lack of flexibility in the language, this will definitely affect or adversely affect your grades.
Must be frightening for you to know about these mood swings, but this is usual following this mastectomy surgery. For every woman who underwent this mastectomy surgery will experience these mood swings.
I see. Okay.
But to overcome these mood swings, I can make an arrangement to consult with a counselor, which will really help to overcome your current mood swings. Okay.
I see. But nurse, I am experiencing some pain around my surgical area. It's really hard for me to bear. Can you please advise me something which can really help me in my pain relief actually?
Yes, prior to that, let me examine your wound area.
Yes,
actually.
please. Yeah,
Okay.
yeah, yeah. Students, in OET speaking, it is very important to respect the patient's privacy and comfort. For instance, here the nurse has conveyed to the patient, let me examine your wound area. It would have been far more appropriate if the nurse had asked consent or permission from the patient. For example, here she could have asked in this way, would you mind if I examine your surgical area?
So, could you please rate your pain on a scale of 0 to 10? And this 0 will be no pain.
Well, you can take it as 8, nurse, yes.
Oh, okay. So, it is a very severe pain.
Yeah.
I'm so sorry to hear that you are in too much of pain. But I can offer, I can give some pain medications which will relieve your pain to some extent. Okay.
Okay, nurse, yeah.
And I examined your wound to show some swelling on that area. Okay. So to reduce the swelling, it's important to do some kind of exercises actually.
Okay.
Okay, so do you have any queries?
No, nurse, no. That was so much reassuring for me. Thank you so much, nurse.
Okay, so I hope that I have cleared all your doubts and
Yeah.
I wish you a speedy recovery. Thank you.
Thank you so much, nurse.